Welcome to Let's Talk Salud, Dinero y Amor. Let's Talk Salud, Dinero y Amor. Today we have a very important conversation. I am with my colleague, Steve Jennings. Steve Jennings is the advocacy director for AARP here in Arizona. I also work, of course, for AARP in Arizona. Steve, thank you so much for making time to join me in this important conversation.
Thanks for having me, David. It's good to be here.
Thank you. And I would like to show just the slide that shows the title. The title, actually, the title is, and let me. It's not going to be a slide. Let me show the banner, and it is higher benefits in Social Security and higher cost in Medicare. And you and I know, Steve, that anybody that is on Medicare goes through this every year. What Social Security giveth, Medicare takes it away, right? They always have to face this. There is something called COLA in Social Security, which stands for cost of living adjustment. And a lot of times what Social Security gives in increase, Medicare increases the premiums, and then there goes the increase. So I really wanted to have you to help us understand these matters. And again, the topic is higher benefits in Social Security and higher cost in Medicare. So let's review, first of all, what is COLA and how is COLA looking for 2021?
If I could mention, David, that
Mm-hmm.
COLA is one of the wonderful things about Social Security. And, many private pension plans that people have through their employers don't even have a yearly adjustment that ups the benefit so that their purchasing power, so that they're able to buy the same amount of things as they were able to buy previously as inflation happens. So Social Security began in the United States in 1935, but it wasn't until 40 years later, a 40-year campaign went on to build a COLA into Social Security, and the very first COLA was in 1975. So it's a wonderful thing about Social Security, and something we always want to fight to maintain, that there's a yearly adjustment to the benefit people get so that their purchasing power does not decrease. Do you want to talk about how much it is this year, David?
Let's do that. Before, though, it's Steve, I understand that there is a formula that takes into account what seniors spend, and then they figure it out. But there's always a complaint that there's some elements or some expenses that are not included in this formula. Can you elaborate just briefly on that?
Well, and it's based on, simply put, a market basket of goods that people buy to live in the United States on a regular basis. And it's called the Urban Wage Earners Index. And what it doesn't take into account is that seniors spend money differently than younger people do. And the main difference is seniors have higher healthcare costs. So they're paying for prescriptions and supplies for their health care. And so AARP actually advocates that seniors have a different formula that more accurately represents their spending than the general population does. But we haven't secured that. So the COLA is still based on how much costs increase for the population in general.
So if I'm understanding correctly, then if they took into account what seniors spend on healthcare, the COLA or the increase on Social Security will definitely be higher.
That's right. It would be slightly higher, David. Yeah, which would be more appropriate, because then seniors would still, year after year, be able to buy the same amount of things as when they got their first Social Security check.
So 1.3% COLA, if I'm not mistaken, this COLA has been in past years almost 3 points, if I'm not mistaken, 3%. It seems a rather low, the COLA. But so this is what we're getting, huh?
Yes, and the last few years, the COLA has been small like this. In fact, David, if you go all the way back to the 1980s, remember the COLAs began in 1975. In 1980, the COLA was actually
Mm,
14.3%.
mm,
I don't know, many of us on Social Security are old enough to remember the kind of inflation that was going on in 1980. But this year, because of the pandemic, and a lot of people were spending less money and
mm.
staying at home. The inflation rate wasn't as high, so that when it's figured out using this index, it's just 1.6%. It's not very much. I think that's about a $20 increase in the average check, isn't it, David?
Yes. Let me ask you, since we're here, I'm showing the tax rate. Some people call it tax, some people call it contributions. Explain to us briefly those contributions that we made to the Social Security and Medicare programs. Would you mind?
Well, when you look on your paycheck, you'll see that it says FICA, the FICA tax as it's known. And that is, if for every dollar you earn, 7.65% of it goes to Social Security and Medicare. And your employer is required to match that at 7.65%. That doesn't come out of your paycheck. And so it's a combined total of 15.3% of each dollar goes into the Social Security trust funds, builds interest over your earns interest over your working life, so that when you hit full retirement age or early retirement, you can actually receive more out of Social Security than you've ever put into it. It's the same thing as company pension plans. They work the same way in the private sector. And one of the biggest pots of money in the whole world is the Social Security trust funds.
Hmm. I'm showing a slide, Steve, that basically um, gives the breakdown, if you will. So the percentage 7.65, we are talking about 6.2% for Social Security, 1.45 for Medicare. And the self-employed, they have to pay the full amount because, as you said, these percentages are matched by the employer. But in the case of a self-employed person, they pay the full amount, even though they still have the ability to deduct some expenses. So in the end, it comes out to about the same. What is it about this point, about the 0.9% in Medicare taxes?
Well, Medicare is funded partially by this contribution that we all make of 1.45% of our wages, pays for part of the Part B expenses, the out of hospital expenses, the doctor, some of the prescriptions, outpatient supplies. That portion of Medicare, only about 20% of it is funded by this 1.45%, and the rest has to be contributed by Congress to keep that program solvent. And, with a pandemic and with the increasing numbers of older people, we need to pay attention to making sure that Congress keeps making enough of a contribution to the Part B of Medicare, the doctor portion, that's outpatient, where this 1.45% goes, to be sure it's funded and able to pay the bills in the law.
And we're not going to get into all the details about this, but Medicare, whereas Social Security is self-funded, not so in the case of Medicare. Correct? And what is it that needs to be done for the future? Very, very briefly.
Well, it's as I say, these premiums we're paying of the current workers, the 1.45% pays a little less than one quarter of the cost of
Mm.
the Part B of Medicare, and so we need to keep the heat on Congress so that they make up the difference, so that the program stays solvent
Mm.
and able to pay the bills it's promised.
Right. Now the I'm showing a slide here. So the 1.3% COLA cost of living adjustment will equate to roughly $20. From what we can tell, before COLA, it was a 1,523 for the average retired monthly uh, amount for retired workers. Now after COLA, it'll be a 1,543, so roughly $20. The good news, and we will see this later on in our talk, Steve, that the Medicare premium is not going as high. So that is very, very good news. In fact, I'll just throw it in there now. It's about $3.90 increase on premium versus $20 that Social Security is going to increase. So that's very, very good news, isn't it?
Yes, and David, on your previous slide there, I wanted to point out that we're just talking about the top line there where it says all retired
Right.
workers, and that's an average, an estimated average, and some people get less than that on their Social Security benefit, and some people get more, and so it's just like a company pension in that you contribute a portion of your wages. The janitor, so to speak, contributes, and his contribution is smaller than the president of the company's contribution. And so the benefit they get when they retire, since the president put in more, the president gets a larger benefit, and the janitor put in less. He or she gets less of a benefit, and their COLA will be smaller amount than the $20, and the president, so to speak, it operates just like a private pension that way. So that
Got it.
figure that shows on the chart there is an average.
Yeah, so the same percentage, but the amount is different once it is applied to the actual amount somebody gets. Let's move
That's
on
right.
a little bit more, Steve. There is a cap. Medicare, the contribution for Medicare does not have a cap. In other words, people, all of us will pay 1.45% on whatever amount we make. However, not so with Social Security. Social Security does have a cap. Can you explain to us what that means and what is the amount for 2021?
When Congress created Social Security, they knew that if they taxed every dollar the very rich made, the rich have the ability to change how they get income. And the only things that Social Security taxes are wages. So they put a cap on the amount of the wages that Social Security would be taxed. And if they make above that amount, that's not taxed by Social Security. And this year, that amount was, I think you showed it there, 137,700 a year you pay Social Security on or less. Now that's going to raise to 142,800. 100% of the amount of wages you get under that amount is taxed for Social Security. Anything someone makes over that amount, 142,800 a year in wages, will not be taxed for Social Security. That's called the cap. And it's a controversial thing. There is some issues about Social Security solvency, being able to pay benefits in the future. And one of the proposals is maybe all wages or a higher amount of wages should be taxed, and that way more money would flow into the system so it would be solvent for years longer.
So this would be one of the options that the Social Security program has to bring in more money to increase the solvency, to extend the solvency of Social Security, and that is to either uh, 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 increase the cap, or even some people say just get rid of it, right?
Yes, that's right. There's a lot of different proposals about it. And like I say, one of the controversial aspects of it is that very wealthy people have the availability. Maybe they don't receive wages, they receive dividends or other forms of income that are not taxed by Social Security. So there is data that shows that the higher you propose taxing amounts, that more people would drop out of the wage economy, and it might not produce the sort of inflows into Social Security that you're hoping for.
Right. I am showing a slide that basically says that for every in 2020, 1410, and now that's going to be moved to 1470, a $60 increase. This is basically the amount that a person needs to make a quarter to be accredited a credit or a point, because as we know, to be eligible for Social Security and Medicare, one has to have at least 40 quarters, 40 credits, 40 points. That means you paid into the system at least 40 quarters. So those are the minimum amounts that you need to make per quarter to get that one credit.
That that
Also,
that
yeah, go
David,
ahead.
that much was deducted from your wages from that quarter. That you're eligible for Social Security if you have earned 40 quarters. That's 10 years of covered quarters, and that amount is increasing. For 2021, you'll have to earn $1,470 in a quarter to get one quarter of coverage. And
Perfect.
this year it was $1,410. That amount also goes up with the COLA.
Right. So we are talking about higher benefits in Social Security, higher cost in Medicare. It's a little bit more than that, but we're going through some of the details. Now, let's just cover some other points regarding Social Security, Stephen. In retirement earnings, some people who retire before, in other words, early retirement, there is a test. It's called a retirement earnings test exempt amounts, meaning that if somebody retired before their full retirement age and they want to keep working, they have to watch how much they make, because in 2020 it was 18,240. In 2021 it's 18,960 a year. Once a person makes more than that within a year, they will be deducted $1 for every two that they go over, and that's why it's very important. The age in which a person decides to apply for Social Security benefits, especially if they do early retirement and they want to keep working, they have to watch out for those amounts, right, Steve?
Yes, you can take, when Social Security was created, they said the retirement age was 65. And that has since been raised. Many of the people working now are going to have to be 66 and 6 months to reach full retirement age. That's
Hmm.
when you'll get 100% of your benefit. But you can begin getting Social Security benefits at 62. But if you do that, they're permanently reduced by a percentage. You can start at 63, 64, 65, but they will be reduced permanently. Now, the other aspect of that is, if many people do anyway take their benefit at 62, the reduced benefit, but they keep working. And these figures on that chart show you that if you're taking the benefit early and you're continuing to work, if you make more than, for this year, $18,240, every $2 you earn over that amount for the year, Social Security will cut your benefit $1. So that's very much a consideration, that you need to calculate your financing, and figure how much you earn. You could end up getting almost no Social Security
Right,
benefit if
right.
you're not careful. So
Mm.
that's something to keep an eye on.
Yeah, imagine, you keep working, you go over 20,000, 10,000 in benefits are going to be reduced. So, it's a very important decision, again, as to when you will be soliciting your benefits on Social Security. Steve,
And
I think there's, go ahead.
David, I want to just tell a personal story about that. I
Go
was
ahead.
considering. I'm 69, and I was continuing to work after 65, and I thought I'll take my benefit, and I called up Social Security, and I actually got someone that said, "Oh, you don't want to do that because you will get a big hit on your Social
Mm.
Security," and they actually talked me out of that. And they were right. I was very much appreciated that Social Security helped me that way.
Steve, another misconception that I think it's out there is that some people think that if they retire early, at say at 62, when they reach their full retirement age, their benefit is going to be then increased to
No,
their
no,
full
no, no,
retirement.
no.
Not so. It's not. So basically, you are stuck with whatever benefit you get, and the only thing you're going to get is that COLA, if there is one every year. And of course, if you keep working, you keep paying into the system, and then that'll reflect an increase on a yearly basis because you're still working and you're paying into the system. But please remember, if you retire at 62, when you reach full retirement age, it will not go up. That is a very important point. On this
And
one, go
you
ahead.
know, David, some people say, though, if you think about it, that Social Security has figured out that you will get, if you retire at 62 and your full retirement age is 66 and 6 months, you will get 4.5 years of reduced Social Security payment. What if you die at 67?
Mm,
You will come out ahead.
right.
And those are the kind of calculations people make. And so there can be reasons to take it early, and you may need the money with this
Right.
pandemic. A lot of people have lost their jobs and are having to take the early benefit to survive. So, a bunch of hard choices we're faced with.
Definitely. Let's just cover real brief, Steve, this two more points here. What do we see? Let's not cover the Social Security disability thresholds for now, but the maximum, it really surprised me that the max benefit for Social Security has reached the 3,000 mark.
Yes, and if you're one of these people, remember earlier we had that slide about the maximum amount of earnings that's
Right.
taxed for Social Security. And if you're paying up in that range and have been doing that for many years, Social Security just takes your highest earning quarters. Typically, there at the end of your work life is when most people are making the most money, and to calculate your benefit. And they do have a maximum benefit, so that nobody gets, so to speak, $1 million Social Security check. The most you could get in 2020 is $3,011 a month. And with that COLA in 2021, it'll be $3,148 a month. That's the maximum benefit, the biggest check anybody on the program gets.
It's my thinking that most likely people who reach the maximum benefit on Social Security, most likely they were people who they exceeded pretty much the cap, right? They made at
Yeah.
least that much. They every year they exceeded the cap, and most likely that'll guarantee them getting the max benefit. So that it will be $3,148 a month if they made that much money.
And
SSI,
David,
Steve, go ahead.
David, it's possible that both a husband and a wife
Mm,
had high earnings jobs. So some couples could get what, $6,200, $6,300 a month if they had both been high earning and paid in and waited to full retirement age.
definitely a possibility. How about SSI, Steve?
Well, and there are those who maybe ran into, were unable, had a physical or mental problem, and weren't able to earn 40 quarters of coverage and qualify for Social Security. So there is a program for them called Supplemental Security Income, SSI for short, that they can apply to at Social Security. They have to have limited amounts of money in the bank and not own things like 3 or 4 cars or 2 houses or anything like that. And the maximum they could get as an individual there is 700. It's a completely inadequate amount of money to try and live on in the
Definitely.
United States today. But nonetheless, for many, it's their only source of income. 783 a month. If you're a couple, you can get 1175 a month. If you have any income, they reduce that amount by the amount of income. So if you're paid $200 a month, you would get $200 less than 783, or you would get 583. So, but that's applied for it. So, Social Security, it's called SSI. And so, if there are people that don't get regular Social Security, or their regular retirement is less than 783 a
Right.
month, then supplemental security income would bring them up to that amount, 783 for one, 1175 for two.
So basically, it is possible to have retirement benefits, and if it's too low the amount, then they can be supplemented by this benefit, but the amount will be raised to 794 now in 2021 for individuals, 1,191 for couples. Let's see what else. Let's move now, Steve. I think we did some justice to the Social Security program and the increases, the COLA, and other elements associated with this program. Let's now move to Medicare. Um, just briefly, we understand that there is no premium for most folks that sign up for Medicare for Part A. You know, anybody who has insurance, we all get from work, say, we all get coverage for hospitals, doctors, prescription drugs. But when you come to Medicare, for some reason, that is separated, right? A for hospitals, B for doctors, D for prescription drugs, and then the C, I skipped it because that refers to Part C, which is Medicare Advantage. But for most people with 40 FICA quarters, they pay no premium for Part A. And then there's obviously other expenses such as deductibles. And then when people go to hospitalizations, there is some payments there. I'll leave the slide. There's just too much information there for us to review every single point. But there is some co-payments when people are hospitalized. And then if people eventually need to go for skilled nursing facility care, after being hospitalized, I believe it's 3 days. Then there's also costs, especially if they need that care for more than 20 days. I am leaving the information there just for folks. They can pause the video if they want to basically get all the details. But Steve, any thoughts on this generally on this slide?
Well, and of course, the point of the slide is to say that on the Part A of Medicare, the hospital portion, we don't pay a premium for that if you're eligible. And all these other costs you see listed there are called co-payments and deductibles. Those are typically covered by a private insurance that many people buy to supplement their Medicare, and it's called a Medicare supplement insurance policy. And it's also, there's another option where you can join a network called Medicare Advantage. And right now we are in the open enrollment period for those. And if you look in the newspaper, you're seeing big full page ads to join this plan or that plan, typically the Advantage plans. And there's reasons to take an Advantage plan, and there's reasons to take a regular Medicare supplement insurance. And you see these numbers scrolling by on the bottom of the screen there that David has put in. That's a free service provided by the government where they have educated advisors who can help you choose which is the most appropriate for you. So you might want to get your pencil and write down that number and call those folks and make an appointment and go over this because it is complicated and you do want to make the right choice. But there is insurance for all those costs you see there. It does cost some money, and so call that number and make your best choice. They won't tell you which one to buy, and they don't get any money from this. It's a government service.
And you know, Steve, it's interesting that in many instances, when it comes to health insurance, we only pay attention to the premium. That's only one cost, but there's all other costs associated with having insurance, such as the ones that I mentioned here for Part A in Medicare, hospitalizations, there's co-pays. Then if you go to skilled nursing facility care, there's potentially there are co-pays. So be mindful that the premium is one level, but there's other levels. And I just want to make a comment before we move to the next slide, Steve, that people who do not have the enough quarters, the 40 quarters, they can still buy. They will not get Part A for free, but they can buy the coverage. But they would have, it's pretty expensive. I have information here, $259 if you have 30 credits or more. and 471 a month if you have less than 30 quarters. So keep that
And
in
that,
mind.
David, that is
Mhm.
that is how much that insurance is worth. This is not the government trying to make a profit off our taxpayers. It's that's how much Medicare, the value Medicare
Mm,
provides to
mm.
you if you qualify. It really is sort of a, although it's just insurance, it's kind of like your income goes up that much a month because you have medical coverage worth that much. Medicare Part A is a good deal if you can qualify. And if you have the money, if you don't qualify and you have to buy it, it's still a good deal.
And Steve, we're looking at about, actually, let me move to the next slide. I'll just get ahead of myself. I still have some parts of for Part A, some points for Part A, but then you have the information for Medicare Part B at the bottom. And it's interesting that if you really think about it, you are paying roughly 148.50 for a month for 2021. That is a good deal. I mean, we know how expensive insurance is, and to pay $148 a month, I mean, I don't know. Some people may think it's too much, but we who kind of deal with these things, it is a very, very affordable and very good cost. And then with all the benefits that you get, I have to believe that you agree with that Medicare is a good program.
Yeah, it is. And this slide, the important part here is this Medicare Part B. Now, that is the doctor portion, the out of hospital costs. When you're not in the hospital, it's covered under Part B and it operates differently than the other portion of Medicare. But the premium, most people, about 80% of people on Social Security that have Medicare, have this deducted from their check before they get their check every month. And in 2021, it's going to be 148.50 there, as you can see under Part B, and that's gone up 3.9 dollars, $3.90 from the what it was last year, 2020, when it was 144.60. Now, because of the pandemic and all the spending, and that some of the doctors that have Medicare, that take Medicare, because people were afraid to leave their homes and get the COVID, they quit going to the doctor, and Medicare started paying some of those doctors some money to keep them in the program. You hear people say, I had trouble finding a doctor to take my Medicare. Well, Medicare knows that, and they're paying doctors a little bit more to keep them
Mm.
in the program when people aren't coming to see them. And that's one of the reasons. It would have, there was some possibility that the premium to keep paying the same percentage of the cost of Medicare could have gone up as much as $50
Wow.
this year.
Wow.
And so there was a big move in Congress. AARP spearheaded this, and we succeeded in keeping that increase uh, down to $3.90 a
Wow.
month rather than 25 to $50, which would have really hit people's pocketbooks seriously. So yes, it's going up a little bit, but not as much as it could have, and we're thankful that we've been able to be of service that way.
And Steve, I think you and I know as people who are, getting at for retirement considerations that healthcare is a big factor in the decision making process to retire. And I am 54. I will be 55 in December. And when I hear talks about allowing people at age 60 or 55 into Medicare, to me that's great news. I hope something is done because I really feel that in retirement, Medicare is such a great healthcare program. And let me mention just one more point, Steve. Just like Part A, the premium for Part A, it's means tested. Also, the Part B and Part D, the premiums are means tested, meaning that anybody making 88,000 as an individual, 176,000 as a couple, they will pay higher premiums for Part B and for Part D. So that is, I think, another point to make, that Medicare is maneuvering the program to make sure that it stays as solvent as possible, right?
Yes, those were later additions to the law that people that have substantial incomes in retirement and are enrolled in Medicare Part B pay more on a monthly basis to help keep the program solvent. And even though they pay quite a bit more, almost all are remaining in the program, because even at higher premiums like that, it is still a good deal in terms of health insurance.
Steve, thank you that you mentioned earlier. We are in open enrollment, both for Medicare, October 15 to December 7, and also the Affordable Care Act, also known as Obamacare, from November 1st to December 15. We are not providing in this presentation a number for the ACA, but it's, if you go to coveraz.org, you can find information. Again, a counselor that will help you review your coverage for the marketplace. Steve Jennings, thank you so very much. We have come to the end of our program. I believe we did some justice to this two amazing programs, important programs to the country. So I thank you very much for your time.
Thank you for covering it. It's important information, David.
Thank you. And we hope that you enjoyed. Those of you who join our program, please remember to share it with friends, and see you next time when we keep addressing important issues. Bye-bye.
Arizona Hispanic Connection.